I do want to play something that the president said today in the briefing about possibly dealing with the coronavirus, because we've been getting a lot of questions about it, and I just want to play it and ask you about it.
Supposing we hit the body with a tremendous, whether it's ultraviolet or just very powerful light, and I think you said that hasn't been checked, but you're going to test it. And then I said, supposing you brought the light inside the body, which you can do either through the skin or in some other way. And I think you said you're going to test that too. Sounds interesting. Right, and then I see the disinfectant where it knocks it out in a minute, 1 minute. And is there a way we can do something like that by injection inside or almost a cleaning? Because you see it gets on the lungs and it does a tremendous number on the lungs. So it'd be interesting to check that. So that you're going to have to use medical doctors with. But it sounds interesting to me.
Just from a medical standpoint, what the president said, first of all, about treating the body with light and somehow bringing the light inside the body, where do you fall on that?
So I think the data that were presented at the press conference today were really important in terms of what kills the virus. And I believe the president was asking a question that many Americans are asking, which is, okay, this is what kills the virus. It's a physical agent, in this case UV light. How could that be applied to kill the virus in, for example, a human being? We have plenty of examples in medicine where light therapy has been used for treatment of certain diseases. So it's a natural question that I, as a doctor, would have expected to hear from someone as a natural extension of the data that were presented.
But just from a medical standpoint, I mean, there's people who are listening, obviously, to the President of the United States and take what he says very seriously. Are you concerned at all from a medical standpoint of somebody, injecting themselves with a disinfectant or, hearing what the president said and trying to experiment on themselves, thinking that might be something worth looking at? I mean, is there any evidence about taking a disinfectant that's used, on the table where I'm sitting and using it internally? That doesn't seem like a good idea am I wrong?
Yeah, I think it's an excellent point you're making. We certainly wouldn't want, as a physician, someone to take matters in their own hands. I think this is something that a patient would want to talk to their physician about. And no, I certainly wouldn't recommend the internal ingestion of a disinfectant. Again, this is a conversation that occurs every day in America between a patient and a doctor. I've been in that position. I'm sure Dr. Gupta has as well. And it's really important that we address them because people will ask those questions of us.
Well, Dr. Hunt, I think we should be clear, though, that the idea of doing some kind of UV light therapy, which is sometimes used for local issues in the body, but not for a widespread viral infection, and the idea of injecting disinfectant, I mean, there's no those questions may be getting asked, but there's absolutely no merit to that. That doesn't need to be studied. You can already say that doesn't work, right?
And I think, Sanjay, that is exactly what a patient would say to a doctor, and that would be the answer of the medical experts to anybody who answered that question.
It does not work.
The American Medical Association President, Dr. Patrice Harris, and CNN's Chief Medical Correspondent, Dr. Sanjay Gupta. Dr. Harris, let me read to you what the CDC director has just told the Washington Post. Quote, there's a possibility that the assault of the virus on our nation next winter will actually be even more difficult than the one we just went through. He adds, and when I've said this to others, they kind of put their head back. They don't understand what I mean. Clearly, Dr. Harris, you understand what he means.
I do, Wolf, and that is important information coming from Dr. Redfield. I think physicians had always worried about a second wave, and certainly we knew that if this virus acts like other viruses, we could see a resurgence in the fall. But I have to tell you, I'm also worried about a second wave to come sooner. I'm really worried about those states who are relaxing some of the stay-at-home regulations earlier. We could get a second wave even earlier than the fall. That's very concerning.
And you're talking about Georgia, where you live. That's also where Dr. Sanjay Gupta lives. And I want to get to that in a moment, Sanjay. But the concern is what happens when the coronavirus, according to Dr. Redfield, coincides with the outbreak of flu season here in the United States. How do we use these next few months to prepare, God forbid, for that possibility?
Well, in some ways, it's the same things that we have been talking about for the last few months. Wolf, you know, we've talked about making sure hospitals are adequately prepared in terms of beds and surge capacity and possibly breathing machines. We got to make sure we have enough personal protective equipment. I think there's two things that Dr. Redfield was really pointing out, and he has said this sort of thing before. I think it's taken on a new sense of urgency as people have learned more about the coronavirus. But the constant is the virus. The virus is still out there. It's still very contagious, as Dr. Harris said. That's why she and a lot of other people are worried about a resurgence even sooner. But this time around, the coronavirus outbreak in the United States sort of came as flu season was starting to wane down. If it comes at the same time as flu season, and flu season can oftentimes require, a lot of patients end up going to the hospital, and you need a lot of those same resources that you would need for a coronavirus outbreak in this country. So both those things coinciding would be of concern, and they would both, make us really feel the need for all these same things: the testing, the ventilators, the hospital beds, respiratory therapists, all those things again. And do we have enough? Right now we sort of feel like, hey, we got through this. The numbers may wane over the summer, but if they come up again in the fall, we have to be prepared.
A drug called chloroquine, hydroxychloroquine, chloroquine, hydroxychloroquine, chloroquine, hydroxychloroquine, the hydroxychloroquine, hydroxychloroquine. That's a lot of good things are happening with it, a lot of good tests.
Any evidence to suggest that, as with malaria, it might be used as a prophylaxis against COVID-19?
No. The answer is no. The information that you're referring to specifically is anecdotal. It was not done in a controlled clinical trial, so you really can't make any definitive statement about it.
Hydroxychloroquine is a very powerful drug for certain things, and it's a very successful drug. There's reason to believe that it could be successful here. I hope they use it, because I'll tell you what do you have to lose? In some cases, they're in bad shape. If it were me, in fact, I might do it anyway. I may take it, okay? I may take it. And I'll have to ask my doctors about that. Our national stockpile is now equipped with nearly 30 million hydroxychloroquine pills. It's having some very good results, I'll tell you. Think if anybody recommended it other than me, it would be used all over the place, to be honest with you. I think the fact that I recommended it, I probably set it back a lot.